Okay, so first of all, welcome everyone. Thank you for joining us. I'm sure a couple of folks will continue to join as we start, but I do want to go ahead and get started, and we're going to just start with introductions. Gina, if you want to go to my slide. Yeah. So my name is Carrie Otteson, and I'm a community programs manager here at DBHDS. And my primary duties are related to specialized funding. So I manage the customized rate program along with a couple of other specialized funding programs like the transitional funding and some Medicaid ineligible funding that I also work with. So welcome everybody. I really look forward to this chat and to having an open dialogue with you. And we're just going to start with some introductions of the customized rate team.
Hi, I'm Angela Clark, and I am the customized rate processor. Welcome everyone. Some of my primary duties include tracking and reviewing all incoming applications, whether it's an initial, an annual, or a contingent application. I also review the application's data and conduct intake calls so that I can see what's needed and present this to the provider so that we can move the application forward, what documents are needed. Also, I manage a customized rate master workbook, which includes information such as region, service you're applying for, what you approve for and the amount, and whether you request home visit, those type of things. And we also get some of our statistical information from it, as you would learn more about later on. I also conduct audits and then send, which is done by viewing some documents and also making sure WAM's information is correct. And then I do send out the notice of action to the providers to include the coordinators. And I participate in our committee reviews weekly and provide training during my intake process.
Angela,
before we move on, Angela, did you want to clarify what the audits are for? They're not for the provider.
Okay, thank you. It's not for the provider, it's to make sure, and I do apologize, is to make sure that the information, what you approve for, the dates, the amount, those things are correct before sending the notice of action to the providers.
Thank you, because I was thinking I can feel the tension in the phone call from providers who are like, "What audit?"
Thank you. Yeah. Okay. We don't audit you, I'm sorry.
No, we're not auditing you. Okay, so I'm Gina Koch. I'm a customized rate technical consultant. I am primarily responsible for the customized rate application assessments to include the specialized formal training. I do a lot of that for new providers and for people who've been doing this several times over. I'm always available for people to call in, to email me, and I do some trainings in the community as well. So anytime that you need some technical assistance or you're not sure how to get started, you're not sure if you did the right things, you just want to contact me and I'm happy to help you. So like I mentioned, I do some community events. I've go to conferences and do some presentations, but also we have some upcoming trainings that I'll get to in a second. I also do the customized rate review committee presentations on every other Thursday. So we have 2 days a week that we can do those committee meetings because we have such an abundance of applications that come in. But primarily with that committee meeting, I am serving as what I like to call a liaison between you as the provider and the committee, because the committee does not generally speak directly to the providers because there's just not enough time for that. The people on the committee have regular jobs here at DBHDS, and so this is a part-time thing that they do. So when I do the reviews, I'm kind of your words are being presented through me. I do conduct site visits on occasion, either by request or by choice, of our department. And I would say that at least 50% of what I do is training related. Javier?
Hello, folks. Gina, can you confirm that you can hear me okay?
Yes, absolutely.
Awesome. All right. So my name is Javier Ramos. I'm also a customized rate technical consultant. And much like Gina, my primary duties are to conduct the customized rate application assessments and to prepare those for the committee that I sit in on, which is on Wednesdays. I also serve as a liaison for the Customized Rate Review Committee and the providers, just like Gina does. And I do conduct 2 formal trainings a month, just like Gina does. However, where our positions differ a little bit is I'm only conducting 2 of those trainings, and over 50% of my work week is dedicated to customized rate on-site visits. So many people on this call, while I was reviewing the attendees, actually I have met in person. And I do apologize. I'm in my vehicle right now, which is why the camera was turned off. I am halfway home from Roanoke.
Thanks, Javier. So we're going to jump in now to our agenda. First, we're going to go over some customized rate stats, just a few quick things that we wanted to share with you. Then we have a training announcement to make. There were a couple of pre-submitted questions that we'll go over, and then we'll get to the point where we'll do our open forum and we'll have some time to have a collaborative chat. You can ask questions, and we'll go from there. So Javier?
Yes. So again, most of my job is site visits, directly visiting the individuals or individuals who may need a customized rate in the future or are currently approved. And when Gina, myself, Carrie, whoever conducts the site visits, we complete a comprehensive, um, detailed notes on what we observed or what we recommended to providers. And we take a lot of those high level responses and put them in a dashboard, which is what you're seeing there on your screen. And what we're able to see on this high level dashboard is the raw number of site visits that are conducted per fiscal year. I do believe these numbers are a couple weeks old, so we're a little more now. And we measure things like whether there's compliance with the notice of action requirements that are given by the Customized Rate Review Committee, and if we, based on our observations, believe that the customized rate seems appropriate. A lot of times, a customized rate may seem appropriate when you're reading about an individual, but when you meet them, it might be a little different. We also do work very, very closely with the Office of Licensing and Office of Human Rights. So when we are conducting site visits, we are not solely focused on customized rates. I would say 10 to 15% of the visit, we are looking at regulatory compliance as well. It's not a full-blown audit, but when we see something, we do address it. And if there is something we have to report, we do report that. In most cases, we're going to work directly with you as long as it's not a major violation. And if you can correct it on the spot, we won't report it. However, again, there are some things that are reported. So that's what you see on the right side of the dashboard there, if there are concerns identified for any one of those divisions while we're on our site visits.
Oops, hold on one sec. There we go.
And so some really exciting numbers here is since the inception of the customized rate, we have grown substantially. So here are the numbers since 2017 or the fiscal year of 2017, and the amount of applications that we received. So you'll see where in 2017 we were at 38. It grew as the years went on, and between 2021 to 2023, it was kind of similar numbers. However, come 2024, we skyrocketed, and now in 2025 we were at 403 applications year to date. Now, the fiscal year does end in about a month here. And again, I think these numbers are about 2 weeks old, so we are a little bit higher now. So I would suspect that we're going to be closing the fiscal year at 450 plus applications. So we have grown substantially, and we're really, really excited that providers are utilizing this, and we're able to support individuals to stay in the settings that they really want to be in. We also wanted to share some of the services or some of the applications that we receive by service. So as you'll see on the left side there, 2,082 applications were received for every service that we have. And group homes really drive that with 1,660 applications, followed by group day support with 291. And you're able to see the numbers for community coaching, in-home support, sponsored residential, and supported living. And one interesting thing that we track as well is the CIS levels of the applicants that we receive. And you'll see, like most would guess, that CIS levels 7 and 6 drive most of our applications. However, surprisingly so, we do have high numbers of CIS levels 1 through 4. Specifically, when you're looking at these numbers, CIS level 2s and 4s, we're seeing really, really high numbers for those. And that may very well mean that an individual has an outdated assessment or may need to request a reassessment because there's certain exceptional medical or behavioral needs that are just not reflected in their CIS assessment. And some individuals do have an appropriate CIS that fall between that 1 through 4 or 1 through 5 area, and just happens to be an outlier that might require 1-to-1 or 2-to-1 supports. So there are some numbers in case anyone is interested in that. And here are our numbers year to date, or since the inception of the customized rate, for approvals, denials, and withdrawals. So you'll see that we have had 1,529 approvals since the inception of the customized rate, which is about 75% of all the applications received. We had 342, denials, which is about 17% of the applications received. And then we did have 155 withdrawn applications. Now, if we remove that withdrawal applications and only look at approvals and denials by the raw numbers, the approvals would be about 81%, where denials would be about 19%. But including withdrawn, we're at about 75% approvals, 17 with denials, and 8% withdrawn. Hey, Gina.
Okay, so as I mentioned, I do a lot of the training. So I'm currently putting together a lot of what we call mini trainings. We have an extended training that covers everything, but then we have a lot of mini things for like providers who just want information about specific aspects of the applications. So those are being developed right now. And they will be available on YouTube, and we'll definitely let people know when they're available. But things like updates and changes to anything going on with the customized rate, annual applications versus contingent, what does that mean? Sponsored residential happens to be a point of difficulty for some, trying to understand what the application looks like and what the requirements are for the sponsored providers. And so we'll have a little separate one for that. We'll have the introduction to customized rate, navigating WAMs with the customized rate, defining 1-to-1 and or 2-to-1, and going into the documentation that's required and basically doing what we like to call a deep dive into what exactly is needed in the documentation and how to put it together. So we do have a full provider training for YouTube that is about an hour and a half, between an hour and an hour and a half long. And then we have another one for customized rates and behavioral services, and basically goes over how therapeutic consultation is important to the customized rate and what the customized rate needs from the behaviorist and from the provider working with that behaviorist. So I'm excited to say that I'll be coming to your region sometime in the next couple of months. I'll be starting out in Region 5 in Virginia Beach, which will just be in a couple of weeks. And so there will be an announcement on listserv, just like you got for this provider forum. You will see one coming out for the different regions trainings that are going to be available. And for those of you in Region 2, you want to notice that we have two separate opportunities. Region 2 is the largest user of the customized rate, I believe. Yes, I think it is Region 2. And so I wanted to do an extra one there. But if you take a look, they're mostly at libraries. Sorry, the libraries don't open until late in the day, so that's why we have them starting at noon. But they're a couple hours, 2 to 3 hours long. There'll be plenty of time for asking questions and having interaction with me, as I go through the training. So we're going to go with questions. I think Javier is going to do the first one.
Yes. So Carrie received a few questions in preparation for this presentation here. So we're going to go through a few. We're kind of going to go in panel style. I'll go first. And the first question that we received was, what would a customized rate look like for group day services to provide nursing support services for an individual with exceptional medical needs? An individual currently has a private duty nurse who attends group day with the individual. However, there have been concerns over what the nurse should be doing versus the group day staff. So pretty good question here. We do see variations. It is going to be case by case, truly. Most of the times where we see that these are compatible services between the customized rate in the group day setting and concurrently occurring with skilled nursing or private duty nursing is for individuals who have both exceptional medical and behavioral needs. Now, the customized rate, the intention of it is not to supplant other services. So it is not intended to provide the same supports that skilled nursing or private duty nursing should be handling. If a skilled nursing or private duty nursing provider has certain supports listed in their 485, then ideally the group day support staff should not really be working through that. Something disappeared here.
I'm sorry. Sorry.
That's okay. So yes, most of the times that we see this is because the skilled nursing provider is providing the medical supports while the group day provider is providing the behavioral supports, because the skilled nursing provider is not there to provide that. Now, there are variations again, and it goes case by case, but primarily that's what we see is skilled nursing providing nursing while the group day customized rate provides the behavioral supports.
Angela?
The second question is, what documents are required and how does it get submitted for the customized rate? I'm going to say some of the documents that's required, supporting documentation, will be behavioral support plan, most recent. We will have behavioral data and health supports data, which we look for accurate, quantifiable data. And we'll also ask for quarterly reports. And typically the data we ask for would be in a 6 months range, starting from the time frame we're in, going back 6 months. And again, this could be different if the individual is newer to the providers, it would be less. We also ask for the 2 most recent quarterly reports, staff credentials, if you're requesting specialized staffing or program oversight supports, then we will ask for credentials. Also overnight support data, our well-known SF20 form. We will ask you to complete that accurately, and also incident reports if applicable. Your provider license from everyone to include your addendum page. The notice of action for those who have had an approval prior and now they are completing their annual application, then we will ask you to please review your notice of action requirements and also upload those. Also, one-to-one or two-to-one staffing protocol, which should be individualized based on the person's needs as outlined in the ISP. If you need a sample, we can always submit that to you so that you can write the protocol. And as I mentioned earlier, other additional information can also be requested. And you would upload all of your documents to the application that you created in WAMS on the customized rate. You scroll to the bottom and you will see attachments there. So you upload all of the documentation there. Never sending any through the email because that's against policy. Thank you.
Okay, thanks, Angela. I'll take the next one. So the next one that was submitted is, do rates have to be renewed annually? And if so, what type of evidence or supporting documentation is required? And how many months ahead should it be submitted? So in our provider guide, let me start with that. In our provider guide, we ask that anytime that you are submitting a renewal, which we call, an annual, we use different terms for it internally. We want it to be at least 30 days before the end date, because our hope is that we can get it from you, process it, and get it through to the committee before the end date so that you can, if you are going to get an approval again, the committee approval will get to you before the end date and you can submit your service authorization in a timely manner so that you don't have to worry about there being any gap in funding. Because if the committee decides not to approve, then you would kind of be hanging out there if you didn't have a standard rate service authorization already in effect. And if that's kind of confusing, you can ask more questions in the chat, or when we open it up, we can go over that a little bit deeper. You're also welcome to call me anytime and I can go into that a little bit more, but at least 30 days ahead is highly recommended. And that is what we have in our provider guide. So what type of evidence or supporting documentation is required? That would be anything that is required for an initial application is also required for an annual application. As well, when you have already done one application and now you're submitting for the new ISP year, there may be things that the committee asked for at the end of the previous approval. So when you get your notice of action in your email after being approved for the first time, it will state some things that you're going to need for next time. And it may have additional things that the committee says, for instance, we need to see that your medical protocols are updated, that they have been reviewed by a licensed medical professional, and that they are dated within the last 6 months or something like that. That's not for everybody. So that's just an example. But Javier and Carrie and I, when we do the applications after they have gone through the committee, we will contact you after the fact to do what we call an exit interview and just kind of review with you why you got the approval and or denial that you may have gotten for something, and explain what was involved in that. And if it's an approval, we're going to go over what you need to do for next time. And so that'll kind of help you get an idea of what you're supposed to do instead of having to rely on just reading it yourself and maybe not being quite sure of what you're being asked. Let me see, is that everything? Also, I want to mention that you do have to show evidence that if you're approved for the customized rate and you're approved for 1-to-1 or 2-to-1 or both, you have to show us by the next time you apply that you have actually been providing that 1-to-1 or 2-to-1 support. So there has to be evidence of that. And that's something that I can help you with on an individual basis. I can go into it a little bit more now if you want to do that once we get to the questions, opening it up for everybody to ask questions. But I can help you kind of figure out what works best for your particular service, and how you might gather that kind of information so that you can submit it in a concise way for next time. And so, yeah, that's that. Javier?
Yes. Next question. I was approved for a customized rate, but it was only an extra $5 a day. Can you explain why? My assumption is that this question is related to it being $5 more than the standard rate. So not to get deep into the rate methodology, because I'm in no way an expert in that, but to name a few items that are included in the standard rate methodology. The state includes things like vehicle mileage, administrative supports, shared allocations, assumed and average DSP pay, just to name a few. There's so many components in the rate methodology, but the important thing to remember is that the customized rate just supplements the standard rate. Now, it does take over in the sense of billing. However, it is supplementing. So what you're requesting is a certain amount of funds beyond what the standard rate is approved for that specific individual. So if you are requesting a specific amount of 1-to-1 or 2-to-1 hours, and a majority of that is already captured or embedded into the standard rate, then the additional funds approved by the customized rate may not be too much more. You also may see a good example of this when we contact you, when you apply for a customized rate and you get denied, and Gina, myself, or Carrie contact you and say, you're able to provide the support you're requesting with the standard rate. And you may say, no, this individual needs 1-to-1 during 3 p.m. to 6 p.m. every single day. And we may say something that's identical or similar to, when we put in your numbers into the rate methodology, it didn't equate to a rate. We use that term very often, and it just means that what you're requesting is already captured or should already be able to be afforded with the standard rate. And I'm happy to answer more questions about that as well, because I know the rate methodology can be confusing.
Hey, I'm just trying to answer a few questions in the chat as well, but we can also get back to them in just a few minutes. But I'll just send that one out. Okay, so are behavioral services required if the customized rate justification involves behaviors? Yes. So in order to be able to identify what is going on with the individual as far as their behavioral needs, we have to have some kind of data to back it up. So behavioral services are required. And I like to put it this way to providers, that if you know how for Medicaid, you need to be able to show Medicaid if they were to come to your home and ask for information, or if our licensing department comes to your home and asks you for information, you have documentation that backs up what you are verbally saying, right? And so our committee and our department has that same kind of onus to Medicaid, where we have to say, this is what was submitted by the provider, and this is why the committee made the decision that they did. Whether they said, yes, we approve, or no, we don't, they have to provide the reasoning, and the reasoning has to be based on fact, not just on a narrative that is given by somebody. So we have the same standards that we have to follow as you do. And so, yes, we do need the behavioral services in place.
All right. Are individuals who are paralyzed in multiple quadrants of the body and always a 2-person lift required to have 2-to-1 staff in all settings, or mainly just their home? So to kind of answer this in a few ways is most lifts and transfers, especially when using a Hoyer, are typically 2-person lifts. That is best practice. However, the need for 1-to-1 or 2-to-1 is solely based on your assessment, and of course the needs of the individual based on your assessment. So it is truly dependent on what your comprehensive assessment findings are. If your assessment, the outcome is that the individual needs 2-to-1 in all settings for health and safety, then you could reasonably apply for that. However, there are there are going to be data requirements. You are going to have to prove what 2 staff are doing at all times, because it may just be that you only need 1-to-1 for this individual and a second staff available at times. That's not 2-to-1 supports. That doesn't qualify for 2-to-1 supports, nor is it the definition of 2-to-1. Or it may be an individual that could be provided the standard ratio if there's more than one person in the more than one staff on shift. What we always go back to is the regulation. In the staffing pattern regulation, it states that staffing patterns should be specific to individual needs. So yes, if your comprehensive assessment shows that 2-to-1 staffing is needed for certain times of the day, then that answer would be yes, but this is a case-by-case question here.
Okay. If a person is a 2-to-1 ratio at home, do they also need to be a 2-to-1 ratio at the day support and community engagement services as well? Well, let's talk about how we divide up different things. So even if you as a provider are providing the group home services and the community engagement or group day, you have more than one service. Each service is its own individualized entity, right? So just like you have to do a service authorization separately for each service, you have to do a plan individually for each service. You also need to do an application for the customized rate for each service, even if you're the provider of all of it. So if a person is 2-to-1 at home, they may need that 2-to-1 at home, but they may not need it at the community, at the day support, or they may need it at the day support. But it's going to be up to that day support provider to submit the application and give evidence as to why that level of support is necessary. As far as community engagement is concerned, community engagement is unfortunately not one of the services that can be that is designated for the customized rate. In our provider guide, you'll see a list of the services that are eligible. The only day services that are eligible would be the group day and community coaching. Community engagement is not part of that. Javier?
All right, next question, and I think Gina actually answered it. Can day support request a customized rate for attendees or just a home? So I'll keep it pretty simple because Gina really went into it. Yes, day support attendees can meet the criteria for a customized rate, and for group day, providers can request 1-to-1 supports with either standard or specialized staffing. And as Gina mentioned, community coaching is another service that does meet the criteria for a customized rate. And with that, you can request specialized staffing since it's already a service that provides 1-to-1, or you can request 2-to-1 support with any variation of specialized and standard staffing. But yes, day support is compatible with the customized rates.
Okay. And the last question that was received ahead of time is, how does the customized rate apply to respite services? Well, it doesn't actually. Respite services is not one of the services that is applicable to the customized rate. And so anytime that the waiver is being used to pay specifically for respite, that would be a completely separate thing, and the customized rate staffing would not be able to be used in that circumstance. And so once again, I want to encourage you to take a look at our provider guide. It's really not that long. I know that it looks a little bit cumbersome, but it's not very many pages, to be honest. And if you just take a quick look through it, we do have a little table of contents at the beginning, so you go straight to the page that you want, and it'll kind of give you that information. But once you have looked at that, please, if you have additional questions, please give me a call, any of us really, but I'm most likely to be available to be able to answer questions like that. So yeah, it does not apply, unfortunately, to the respite services. I did want to answer a question that's in the chat regarding about the rate methodology. So I just want to give you a little this is how I explain it when I'm doing training as far as the rate methodology is concerned. Many of you may have been around when rates were set and were being reviewed by, I don't know if you ever heard of Burns and Associates back in several years ago. They did a rate study to kind of come up with the standard rates. And then when the customized rate came along, they also used their same formulas to be able to put together rates for the customized rate as well. So the committee, I want to make it clear, does not decide a rate. When the committee is meeting and going over your application, they are simply reviewing the information and deciding, yes, this person needs exceptional support, or no, this person does not. Okay. Beyond that, the rate is set by something that we have on hand that is called a rate model, and it's different for each service. And within that, just like at DMAS, they have formulas to be able to put together all of the reasoning behind the rate. We have that same thing, like I mentioned earlier. And so we just put in the variables that the rate model asks for, and then it determines a rate on its own. There are formulas that are hidden behind the document. It's an Excel sheet, basically. And we are provided that by DMAS. We do not here in the customized rate department have access to determine the formulas behind the scenes. But if you are interested at all in understanding how the rate study happened and what was put into that and how it's been developed since then, you can really just Google Burns and Associates and Virginia and be able to see the published, it's several pages actually, but a published document that kind of breaks down exactly how they looked at things from the beginning. And then I'm not sure if there's been updates to that document, Carrie, but I don't know that there have, but it's based on the same model as the original, right?
Okay. So that wraps up all of the pre-submitted questions that we had. So now we really want to open it up to you for your feedback, comments, questions, concerns, anything at all really that you want to get into. We can do that. So if you want to put your questions in the chat, I know that there's some already in there which we can go over, or raise your hand or just take yourself off of mute, whatever you prefer.
If I could ask Cheryl Simpkins, would you unmute yourself if you can? Because I don't understand the question exactly that you have in the chat. Regarding individualized circumstances, what if an individual who is new to a day program had an existing BTP? I'm not sure what BTP is. Are they able to take themselves off mute, Carrie? Because I'm not sure that they can. Where is
They
Cheryl?
should be
I
able
think
to.
someone just said no.
No,
No.
okay. I don't know if we can take them off mute, probably not. I don't know what a BTP is, but if you could put that in the chat, Cheryl, and just, sorry, it's probably something simple, but this is the question right here. I'm just putting it back in the chat. Let's see.
Gina, I'm sorry to interrupt. Is it
Yeah.
Cheryl Skins?
Yes.
All right, Cheryl, we do have the ability to allow your mic. So I'm going to go ahead and do that. And you may just have to unmute yourself. Go ahead, Cheryl. On.
I just did. Thank you. A BTP is a behavioral treatment plan. And the question that on, hi, thank you. What I'm asking is, when we have an individual who comes to the program, and it may not be something you know initially, but in doing a little bit additional research, reading, and learning that the individual has some serious behaviors and they basically have a one-to-one, and to a degree, well, right now, you don't really know how it's going to be in a day program, but you've had some precursors that you know there may be some challenges. This is my second time going through this. Initially it was 3 months, so it's good to know it's now 6 months. But I'm wondering in situations like that, because the behaviors are unsafe. If they're unsafe behaviors, how long or how much data would have to be taken in order to apply for a customized rate for someone like that? Since we look at things on an individual basis, case by case. Um, it's just that's what I'm wondering. How long would the data be required for that person in order to apply, especially if it's a safety concern?
Okay. Who wants to answer? I can answer, or Carrie, or
Go for it, Gina.
okay. So basically, if we've got a lot of different options, it depends on how long that person has been in your program. I can often help, or Javier or Carrie, we can help you kind of get information from other sources. In our provider guide, you will see that we like to have at least 6 months worth. But that is no longer, and it hasn't been for a while, been a must-have. We know that there are circumstances where you're not going to have that. Maybe they're new to your program. Maybe the behavioral situation only recently became very serious, like you mentioned. So there may be a lot of reasons why you don't have that yet. I do want to say that when you start to realize that you have somebody with a behavioral problem or even a health problem, you want to start taking data as soon as possible. Go ahead and put in your application, and you give us as much as you possibly have at that moment and explain why you don't have more. Once Angela gets that and starts processing, she will let whoever she's giving that application to, myself, Javier, or Carrie, she will let us know, hey, they only have this much data and this is what they say the reason is. And then when we contact you, we will go over maybe some ways that you can obtain other information. Maybe you only have 2 months worth of data, 3 months worth of data, but you have incident reports, you have police reports, you have CRIS reports, you have hospitalization documentation, REACH, various other things. Maybe the support coordinator has information from a previous provider that they keep in their quarterlies and their documentation at the CSB. So there's a lot of different things that we can try to help guide you with to try to get that information from somewhere. And then a lot of times, let me continue with that a lot of times the committee, if they see that there is an emergency kind of situation, like or an urgent situation, I should say, because basically everybody's who is applying to us has some pretty severe things going on. But if the committee is like, okay, we see that this is really not good, this is unsafe, they may give you a short-term approval, which we call the contingent. Angela mentioned that earlier. And a contingent approval only goes for a couple months. And that gives the provider a little bit of extra time to be able to collect more data to be able to submit. And so you would have your possible, if they approve you, you'd have an approval for maybe 3 months or 6 months even. And you keep collecting your data. And at the end of that time, you don't submit a new application. You simply submit all the data that you collected or anything else that the committee asked for at that point. And then we go from there and they look at it a second time and determine whether it needs to be continued to the end of the ISP. Because we want to keep in mind that the dates that you're approved for coincide with the ISP dates. Okay, so your application approvals are always going to end on the last day of the ISP, no matter if you submit them a year before, 6 months before, 8 months before, or you submit them a week before. They will, if they get approved, they would only be approved for a week. So just keep that in mind. Okay.
Awesome. Thank you. I appreciate that. That's very helpful. Thank you.
Good.
Anyone else wanting, if you cannot take yourself off of mute, you can just raise your hand and I can take you off of mute. I wanted to go back through the chat and try and pick up on some of these questions that are in here. One of them was, will you be providing of the required documentation to show what is required and how to complete? If you go to the DBHDS website, you can actually get a copy of our provider guide, which has a little chart in there, and it has all of the required documentation that you need to submit with your application and how much of that information is needed. So that's in there. The other one, why does the application change from year to year? It would be so much easier to submit the application if the format isn't changed annually. So our application is in WAMS, and it has not, the format of how you submit that application and the questions, the prompts that you're filling out have not changed. So Patricia, if you wanted to elaborate, if I'm not answering that question, you can just raise your hand. I'll take you off of mute, or you can put additional info in the chat, because I'm not sure what that might be referring to. Maybe it could be referring to our SF20 form that has changed a couple of times over the past 5 years. But otherwise, I'm not sure what that one's talking about. Gina, I see that you have been fielding these questions. So let's see, what else?
Well, I did want to ask Jess Helbert, if you could take her off of mute, because she asked a question. I assume she, I'm sorry if I'm saying she, and it's something different, but it would be a lot easier if behaviorists were able to access the customized rate application via WAMS. I currently work around it via encrypted emails with copy paste. It's a pain and causes a bit more work than direct entry. Are there plans for this? And then she, or they continue, took a shortcut there. Me answering the behavior questions section and relying on providers to copy paste the information, including charts and graphs. So I think what you're saying is that you want access to you're a behaviorist who wants access to the customized rate application. Is that what you're saying?
Yeah, and you got my pronouns right. I'm she, her. I know Jess
Okay.
is
Either way.
Gender
Yeah.
neutral name. But yes, I'm a behaviorist.
Okay.
And currently I work with 2 folks who receive customized rate. And the application process on my end looks like the providers are the providers who initiate the application are the only folks who can input into the application. And there is a specific behavior section, and everyone says, oh, you answer this and, provide these charts and graphs, and that's, typing it up and sending it over. And I've gotten some feedback, I think, from Javier, where someone included one of my attachments into the wrong section and it created some confusion. So I'm just curious, is there plans for behaviors to be able to direct enter into customized rates for folks that have that?
I'm gonna let Carrie answer that.
Yeah, so there currently, no, there are not plans, but that's one of the reasons we wanted to have this forum, is to get information from you guys on the things that you're interested in seeing changed. So that's certainly something that we can give some more thought to. My only initial concern is that we do see a lot of turnover with how many behaviorists an individual works with over time, and it might get a little complex being able to have access to the application in that way, but certainly something that we'll add to our takeaways from today to think further on.
Thanks, I appreciate that.
Yeah. All right, what else do we have here in the chat? I lost my spot.
Let's see. Christina Johnson again states, someone who has SI that is a tier 2 and doesn't have a behavior plan but requires a high level of supervision to prevent the SI, what documentation would be required to get the customized rate approved? So I want to say SI, you mean serious injury? What I'm not sure exactly what you mean. Is that what you guys think that SI means?
Who's the person? I can take them off of mute.
Christina Johnson. suicidal ideation. Okay, I'm sorry. Everybody uses their different acronyms for everything. So someone who has suicidal ideation that is a tier 2 and doesn't have a behavior plan, but requires a high level of supervision to prevent that, what documentation would be required? So personally, I would say that, again, we just need data. Data drives the customized rate, approvals, denials, all of that. Because you have to be able to show us through data, which can be what we call raw data, which is that the providers taking themselves, the DSPs are taking data moment to moment, hour to hour, half hour, whatever the case may be, that we call raw data. And then graphed behavioral data or graphed any kind of data, medical data, whatever, would come from a different source. You don't have to do that yourself as the provider. But basically, we want to be able to see how often is the suicidal ideation happening? What does it look like? Okay, so when the person is doing this, are they just verbally threatening? Are they making a plan and telling you what their plan is? Are they motioning to some kind of a implement that they plan to use on themselves, or tell us what's really going on, and then what kind of support you're actually having to provide to that person as they're in the midst of this suicidal ideation, and how long does it go on? It's kind of similar things to, if any of you have been, or those of you who've been in the SIS assessments, you kind of find out, okay, does this person do this? Yes. How often does that happen? What is the range of time that it goes on? What kind of support is needed during that time? We're kind of asking those same kind of similar questions, and that's basically how the committee is making decisions, is based on the picture that you paint with your data that you are taking and your explanations behind that data. So I like to tell providers who train with me that you can paint a picture that is, elementary and middle school level, or you can paint a picture that's high school level. The better the detail in your picture, the better the communication is going to come across to the committee to be able to understand what's going on. So you paint your picture with the data that you are taking, and, we can all take a look at it and say, oh, I see what's going on here, and it's lasting this long, and this is the intervention. Hopefully that explains it, but does anybody else have anything to jump in on that with Javier or anybody? No?
No.
Okay. What else, Carrie?
Let's go back to the chat. I was trying to find a way to unmute everyone, but okay.
So Dr.
There's somebody
Davis,
with their hand up. Let's see.
that's Jess Hilbert.
Okay, you should be able to go off of mute, Jess.
Perfect. A question is, what are some of the most common mistakes and errors you guys see that would be really helpful for providers and people filling out the application to get ahead of?
Well, I'll ask that Angela help me out with this a little bit in terms of what she sees on the intake, because she really is the front process of part of the process. But I will say, once we get to the committee level, a lot of what we see is missing information. So missing data, specifically overnight data and behavioral data. A lot of times those things are missing. But I'll let Angela speak to it a little bit as well, because she does do the intake process, and yeah.
Okay, all right. Also, thank you, Carrie. Yes, and also when it's requested for you to provide a certain amount of data, that's what we're looking for. But there are times when we request a certain amount of data and less is provided. And so it still doesn't paint the picture, as was stated earlier. Also, making sure that when you upload your documents, you have the correct subject matter or topics such as protocols, behavior data, give us the month, however you're scanning it in, make sure that your subject matter makes sense to us, because the committee, we have so many applications at that time. And even when I move it to the consultant level, it's more questions they perhaps would be asking me about the application. But if it's clear and it's concise, when it comes to the data, the organization of the data, making sure that it makes sense to you so that it would make sense to us. Reviewing your applications over. When you complete your application in WAMS, review the application, make sure, because sometimes we are completing the application or we're doing something in an office and someone distracts us, and I'm sure that happens so many times. So when we're distracted, we could make mistakes, errors. And so we want to go back and make sure that our application is stating exactly what we want. A major one that I can also think of is the SF20 form. It must match your application requests. So if you're requesting 24 hours on your application, your SF20 should be showing us 24 hours, whether it's done 7 to 3, 3 to 11, 11 to 7, or whatever other schedule you like, because it doesn't have to be that way. Um, just let us know, and it must match 24, 24. If you're requesting 2 hours, 2 hours, make sure they match. That's like a major one. If you have a individual that attends a day service, make sure you subtract those hours from the SF20 form. So just for example, you have an individual that you're applying for. You also applying for overnight. So in your mind, it seems like it's 24 hours you're requesting because you want daytime and overnight. Well, if you say 24 hours and this person the individual is attending for a day support for 6 hours, it cannot be 24. So you're going to make sure you subtract that 6 hours from your total hours that you're requesting. And it's a nice example on tab number 2 on the SF20 form. Very nice example right underneath of where you place your schedule. Right on the bottom is an example. Very nicely put for you to follow. So check that example out when you're completing these, and it would make all of our jobs so much easier. The process would be easier for yourself. We can make sure that your application goes through more smoothly. And it wouldn't be so much delay in time as well, because time is money for you guys, right? Those are the things I can think of.
Okay, thank you, Angela.
You're welcome.
Javier, you've been quiet. You want to take a question?
I haven't seen questions. I haven't looked at questions because I was trying to figure out how to unmute everybody. And I will say that I figured it out, so everyone is able to come off of mute. That is
Oh,
the
yeah,
product.
good,
But
good.
if we do have a question that you want to bring to me, I'm happy to read it.
There's one in the chat. It's the committee reviewed an application for an individual receiving services and requested additional information for Group Day. We can only obtain this information from the residential provider, and it's specifically about occupational therapy and physical therapy, as well as documents related to the criteria for an arm splint. So these documents have not been received by the Group Day provider yet, but the committee has granted an extension. There is concern about what will happen if the documents are not received by that deadline.
So we encourage you to reach out to the support coordinator. They should be able to speed up the process for you to obtain the necessary documentation. If it gets to the point where you are not able to get what you need despite the support coordinator jumping in, let the consultant know who you're working with, whether that be me, Gina, or Carrie. Let us know which provider you're having an issue with. We will reach out directly to them if we can and obtain what we need to get. Of course, primarily, we do ask that you obtain anything we ask for. It is going to be your responsibility. You're requesting the extra funds, so we want you to collect as much as you can. But when you run into some of those barriers, we may be able to jump in and support you.
Okay. What
I think
else?
there's one more,
One more?
Dr. Davis. When a customized rate is denied due to concerns related to missing or needed protocols or physicals, do you suggest the owner provider discontinue providing a needed one-to-one supervision due to fiscal oversight? As a consultant who assists providers with submitting customized rate applications, if an ISP is indicative of a one-to-one or two-to-one level of support, and a doctor has ordered one-to-one or two-to-one support, what is the provider's responsibility to provide the level of support per the standards of medical necessity? Some providers will not provide the needed support if it is not paid. Who'd like to answer that?
So it's the provider's responsibility to provide the support that an individual needs, right? So whether or not a customized rate is approved or denied, I would say no, do not discontinue the supports and services that they need. So Gina, you want to elaborate on that a little
Yeah.
bit? I can look in your face and tell that
Yeah.
you want to answer.
So I do want to say that we've spoken to some licensing people about this to try to kind of determine what is expected. And so I really recommend that you talk to your licensing specialist, but there is a regulation within the licensing regs. It is licensing reg 105-590-A1. And it states that the provider must assess what kind of support the individual needs. This is not word for word verbatim, but this is the gist of what it says, that the provider needs to establish, this is what I need to do for this person. This is what their needs are, and then provide that. Whether or not there is additional funding, you have to provide what the person needs regardless of everything else. That they're establishing what that person needs is your primary function as a provider. And so if you can apply for extra funds to be able to supplement that, great. But if you don't get those funds, you still have to be able to provide what that person needs, which is basically what Carrie was just saying. So I highly recommend that you contact your licensing specialist to kind of go over that. I'm going to put the licensing reg in the chat unless somebody else has already done that. And that way you can look it up for yourself and take a look at it.
I have put that in the chat, Gina.
Looks like
Awesome.
Javier did that.
Awesome. Perfect. Thank you.
Did we answer this one? What is the responsibility of the therapeutic consult? Did we read that question off?
I don't think so.
So what is the responsibility of the therapeutic consult while assisting with this process? Is it solely to provide the behavioral support plan data and training documentation to the waiver provider that is seeking the customized rate? Javier, you want to take that one?
Yes. So there is a really great training online that Gina mentioned regarding therapeutic consultation and the customized rate. That is on YouTube. I'm happy to link it once I answer this. But your job as a therapeutic consultation provider is really to support. You should already be doing what the customized rate would like for you to be doing just by simply doing your job. However, there may be some additional documentation or some recommendations that the committee may have specifically that falls under your scope of practice. What we see pretty often here lately is some therapeutic consultation providers, specifically behavioral supports, we are asking a lot more for replacement behaviors, graphing and collecting data points for replacement behaviors. That's a really good example of things that not every therapeutic consultation provider may do as a standard, but the committee may ask for that. We're always going to go through the provider requesting the customized rate in order for them to collaborate with you and make sure they get those things. But you should be meeting your responsibilities simply by doing what your scope of practice and what's under your service allowable activities are as a standard.
Maybe Angela, did you want to mention the people that you contact when you first get their applications?
mention in?
Because you contact more than just the provider when you're doing the intake, right?
Oh, okay. Yes. In order to at times expedite and move forward, I have contacted coordinators. I have contacted behaviorists and also allow the provider to know that they can also speak with the previous provider to retrieve information or documentation needed.
Yeah, so I mean, I think it's really good that Carrie established a while back that, basically we were reaching out to the behaviorists and, so I think Angela, you send emails or you do phone calls with the
I do
behaviorists?
both. I do both because sometimes, again, going back to, and I don't want to beat anyone down, but going back to the applications, a lot of times the information for the behaviorist is not correct. Or spelling wise, something could be off. And so I would go to the contact information and contact them by phone, or I would ask one of my coworkers or someone else, reach out to them so that I can establish some kind of communication so that we can move the application forward and assist you providers. But please try to look at your applications, answer all of the questions, and just review it again, to make sure everything is completed, because this can also help the process.
And I think too, trying to involve the support coordinator and the behaviorist, I mean, it's just been invaluable because that gives you those two entities the opportunity to have input because really the provider is the one responsible for the application. And so when you view the training video for how behaviorists are incorporated into the customized rate, you'll see, I can't see who's talking there. But you'll see that, we want you to have a really good communication situation going on with those entities if you're the provider and vice versa. If you're the behaviorist and you know that one of your people is having, looking into the customized rate, I don't know, Carrie. I mean, I wouldn't see any reason that they couldn't reach out to us because they would automatically have an agreement with us to be able to discuss the person, right?
Yeah.
Yeah, so I think, they could reach out and say, hey, I want to give you some more information, kind of a thing.
Okay, so Aletha Davis, I have an application waiting to be submitted. I have delayed submitting it because I have been having some challenges with getting the SA approved. Could you elaborate on what you mean exactly? I'm not sure if you mean you have a service authorization for the standard rate.
Is anybody else here?
Aletha, are you still on? I'm not sure what that means exactly, but essentially you should submit your customized rate application as soon as you can. And because when you submit it and you've submitted a completed application, that's the date that the customized rate will be approved from. And then you should be billing the standard rate up until that point. So I hope that answers your question. You wouldn't put in for the customized rate service authorization until you are approved for it. Let's see.
Unmute herself, but having some issues.
Okay. Let me know in the chat if I didn't answer your question. I think I did, but if not, let me know.
I'm sorry, I was trying to unmute. I apologize.
It's okay.
Good afternoon. What
Hey,
I
Ms.
was saying
Lisa.
was, hi. So I've done a couple of customized rates, and one a time before when I did it, I was waiting for an approval for a different service, and they wanted to make sure that that service was approved before they approved the actual customized rate. And so I didn't know if that fit for what I'm doing now. So I have an SA that's in trying to be approved through the SA. I mean through the service authorization unit, and there's some issues with how I formatted it and what kind of information that they needed. So I delayed sending in the customized rate because I don't even have the standard rate right now because they haven't approved the SA. So I didn't know if that was correct, or should I send it in and just wait until the things kind of clear up with the standard rate, or I'm just at a loss, and I just want to make sure I'm doing it correctly. So I have everything in there and I'm just waiting to hit submit. But because I've been having challenges with getting the regular SA approved, I just hesitated to put it in.
Yeah, I would recommend go ahead and submit it because, like I said, then you're gonna solidify the date of approval for your customized rate. And it will backdate to the date of a completed application received. So I would recommend going ahead and submitting it.
Okay.
Yeah.
Okay.
Okay, the other one on your recommendation, let's see, I'm not sure. Let me try and read this.
Is it from Claudette?
Oh, from Claudette, I think what you're asking is if the committee makes a recommendation that the individual explore day services and they refuse, what should you do? That's okay. You can just let us know, send in information regarding that was their choice to do that. I hope that.
Can I piggyback on that?
Yeah, of course.
They would just have to, you would have to supply evidence of that the person was given choice, because it is their right to have choices. And so usually the support coordinator would try to set up maybe referrals or set up tours or whatever. And if the person says, yeah, I don't want to do this, or the provider says we can't take them because they have such extreme needs, then the support coordinator would be documenting that and could provide you with that documentation to say that these 2, 3, 4 different places were attempted, and here's what happened, and that would be sufficient. But you do have to have evidence of that.
What other questions do we have? You all should be able to unmute, or you can raise your hand. We also would love to hear your feedback. If it's not a question, a comment would be nice. Anything that you would like to see changed about the program, improvements that we can make. Let's see here.
Cheryl was asking, she was thinking of an individual that they couldn't help previously. Does the individual have to be Medicaid waiver to be eligible for the customized rate? And yes, the customized rate is only available to individuals with the waiver, with the DD waiver.
Paulette, you should be able to unmute.
Okay, like you can hear me now. I just saw the function there. Good afternoon, everyone. First, I just want to say a big thank you to the team, Carrie, Gina, Angela, and Javier. You guys have been awesome. The support that you provide, the guidance, the patience, it's been phenomenal. I would say of all the units under DBHDS, you guys are stellar.
Well, thank you, Paulette.
Thank you very much.
I'm serious, very professional, very responsive. So it's been great. I did have a question that I posted, but it has been answered. But I want to follow up on that. I asked a question about, so we got approved for the 24-hour customized rate, but now the individual is getting ready to start day support. And I know that they are pursuing their own customized rate. So my question is, if for the year, since the customized rate is for the ISP year, if they are approved mid-year, will I have to refund some of the money like that I'm, that I'm billing for? Because I have for the full 12 months, right? So the full 24 hours, but now they're going to be supporting him maybe starting in June, 4 hours or twice a week for a few hours. So I'm just wondering if that will be impacted by the billing, or should I be prepared to make those adjustments? How is that normally handled?
So if they're going to day support, or if they're getting ready to start a day support, the first thing we need to do is let us know about those hours so that we can adjust your rate. And the rate is a daily rate. So, looking at it from the yearly perspective, you don't have to apply that. So first thing is let us know so we can adjust the rate, and then we would make that adjustment and you wouldn't have any, payback status or anything. Does that answer your question?
Yes, it does.
Okay, perfect.
There was another question, Dr. Davis, I think you and I are on the same wavelength. What oversight does the CRC provide, CRRC provide to ensure that a residential program is providing the 1-to-1 or 2-to-1 as approved? Can you address how a 1-to-1 level of standard support documents only on that individual and not all other individuals in the group home as part of the ratio? So I think what you're asking is, how do we ensure that the customized rate is being used appropriately? I think that's what you're trying to say. Yes, that is what he's trying to say, or they, I'm sorry, I don't know that it's a he. They are trying to say, but yes, we do have some things that we do. Sometimes when Javier or myself or Carrie or whoever is doing site visits, there are things that we are looking at. We do sometimes get complaints from other sources that say, we don't think that this is being utilized correctly. And so there might be an unannounced visit. Sometimes, Javier, you could probably talk to us a little bit more about licensing and all that.
Yeah. So we do receive, as Gina mentioned, we do receive some complaints at times, either from the Office of Licensing, Office of Human Rights, or even other providers, old staff of the providers, whoever it may be. When we receive those complaints, we do direct them directly to Licensing and Office of Human Rights. And in most cases, myself or Gina are going to conduct an unannounced site visit to ensure that the supports are being provided. And while we're there, we're also going to dig a little deeper. I often will, something that Gina actually taught me is to review every individual's progress notes for certain days, regardless if they have a customized rate or not, to make sure that the person signing those progress notes are not the same person that was scheduled to be a 1-to-1. So it's a quick and easy way to find out if the supports were actually being rendered as approved. And as Gina mentioned a little bit earlier in an earlier question, is we do require evidence that 1-to-1 or 2-to-1 supports was rendered during annual reviews. So that is something we're looking into as well each time that we receive an application. So we are conducting our own little mini investigations, sometimes by ourselves or sometimes alongside licensing and human rights when we do hear of issues.
Yeah.
What other questions do we have? Like I said, feel free to just go ahead and take yourself off of mute, and or you can raise your hand.
Cheryl Simpkins says, having experienced this challenge multiple times due to additional behavioral support needed, this discussion has me wondering, is there an equivalent option of this nature for individuals who do not have Medicaid waiver?
I'm not aware of anything, but we do have Nicole DeStefano on the line. That might be a better question for her to field.
Sorry, can you repeat it? I have Susan
Yeah.
Moon in my office talking to me about something and I'm listening to both.
Okay,
I need
sure.
to go. I'm sorry. It was all my fault.
So,
Thank you.
the question is, having experienced this challenge multiple times due to additional behavioral support need, this discussion has me wondering, is there an equivalent option of this nature, such as the customized rate, for individuals who do not have a Medicaid waiver?
There is DAPT and FAPT funding, but that is not specific to exceptional rate in Medicaid world. We are the operators of the DD waiver for the state of Virginia. And when it comes to Medicaid specifically, that would be actually more of a DMAS question. There's nothing like this in the CCC Plus world. And there's the only other things that I can think about are FAPT, which would be for children that are in school and have school age needs through IDEA, or DAPT, which is additional supports and funding for residential services for individuals with serious mental health issues, coming specifically out of a hospital setting. I hope that answers that question.
Thanks, Nicole.
Yep.
Thank you.
Someone asked, how long do we have to resubmit an application after it's denied? And Gina answered in the chat, but for those of you who are not paying attention, it is 30 days. You have a 30-day waiting period, and then you can reapply. Other questions? I see some people are already hopping off. I don't want to drag this out, but if there are questions, I certainly want to stay and answer them and hear your feedback. Are there any things that you would like to see changed with the customized rate or improved upon?
I'm afraid of that answer.
Okay. Looks like it's quieting
I think,
down, but
I'll have one comment there about not necessarily something that could be changed, but something that I think is quite positive about this process from my lens as a behaviorist. Behavior data is always really important for providers to collect. And the annual application of continued behavioral monitoring is really a reinforcer for behavior data collection to be maintained throughout the entire year. And so that while the reapplication, I understand it is a lot of work, and there are some situations I can commensurate with folks like, of course, this person needs a customized rate. They have really extensive and intense support needs. But I do appreciate the oversight and guidance and just the adherence to like where the person is and what has or hasn't changed, and the reinforcement of the continued data collection of the process. The only thing of that could improve from my lens is anybody who needs to have their hands on this application when it's time to submit, being able to do it directly into WAMS, which I've already addressed, and I appreciate you guys as well.
absolutely. Okay, we appreciate that. Thank you.
Thank you. Lisa Williams wants to know where, remind her again of where on the DBHDS website is the provider guide.
It's under waiver services, and I'm pretty sure, Nicole, you put it in the chat as well as a link.
Yes, the link
to
is
get
in there and it brings you directly to waiver services, and then you'll just have to click on customize rate to drop it down.
Others? Okay, looks like it's quieting down. Questions are slowing down. So I'm going to go ahead and close things out here, but I want to thank you all for joining us. It really does mean a great deal to us to have these types of conversations and be able to get direct feedback from you. So we really appreciate you joining, and we hope that it was helpful to you as well. Thank you. Okay, bye,
All
folks.
right. Thank you. Bye, everybody.
Thank you.
Thank you.
Have a great day, everyone. Stay safe and well.
Thank
Bye.
you. You too.
Thanks.